Okay, so moving right along, we're gonna do our urine specimen on our little baby. Okay, so I've got my baby here. I've performed my kiwis, washed my hands, and put on my gloves. So my little baby's got her little diaper on. So we're just gonna remove the diaper, and before we get the specimen, we're gonna perform some peri-care. I obviously don't have a urine specimen kit for babies at home, so I'm just going to simulate that part of it, okay? But I'm gonna go ahead and provide some peri-care with my little baby soap and water. We're just gonna clean the little baby with our soap and water, okay? Then we're gonna dry the area, okay? Now that that's done, I'm gonna go ahead and get my collection bag. Gonna get my collection, my collection bag. And these would have an opening for the genitalia of the baby. So if the baby was a little boy, had a penis, we would put it right over the penis. But since it's not, we're gonna put it down a little bit. And there's a little sticky part. It kind of looks like the same setup or idea as the colostomy bag. But we're gonna go ahead and do that. Remove the sticky part and place it over the patient's genitalia. And then there's a little spongy part around it, so it's not so harsh on the baby's skin and it's not very, very uncomfortable. So once we have that, we're gonna go ahead and apply that to the baby, and then the bag would stay on the patient. Obviously, because the baby can't tell us when they're voiding, so we just have to frequently check them whenever we're doing our rounds to assess if they voided or not. Usually these bags will sometimes have a little valve to where you can empty it as you would with a Foley. That's if you needed constant I's and O's on the baby. But for this, we're just doing a basic urine specimen on the baby. Just in case mom has done any drugs or done anything like that, we want to test the baby to make sure the baby's not positive, the baby doesn't have anything like that in their system. So we would go ahead and apply that. And once we've done that, the bag is just gonna sit in the diaper, and we would apply the diaper back to the baby, and we would wait for the baby to void so that we could get the urine specimen. And right now my baby has the urine specimen collection back on with their little diaper. Thank you.